Is hurricane season changing as we know it? A meteorologist from the National Hurricane Center shares lessons from this past storm season. Plus, the fight against fentanyl abuse will take you inside the effort to equip Southwest Floridians with life-saving tools like Narcan and hear from experts about what parents can do to help protect their kids from this deadly epidemic. That's coming up next on Southwest Florida in Focus. You're watching Southwest Florida in Focus. Coming up this hurricane season, some Southwest Floridians experienced storm surge like they had never seen before. We talked to an expert from the National Hurricane Center about whether Florida's Gulf Coast is becoming more vulnerable. Turning the tide on fentanyl overdoses. Southwest Floridians learn how to use Narcan to save lives, and experts share what parents need to know to protect their children from deadly opioids. Plus, the ancient horseshoe crab, essential for modern medicine. Find out how a citizen science program is working to safeguard these 445 million-year-old creatures. Hello, I'm Sandra Viktorova. Thank you very much for joining us. Today, we begin with encouraging news in the battle against drug overdoses. U.S. overdose deaths are down, giving experts hope for a long-lasting decline. It appears that we're seeing a similar trend in Florida. The U.S. Centers for Disease Control and Prevention projects approximately 97,000 drug overdose deaths in the 12-month period that ended June 30th. That's down 14% from the previous year. The CDC projects about 7,000 overdose deaths in the state of Florida during that same period. That would be about a 16% decline from the previous year. Opioids like fentanyl continue to be deadliest in this ongoing drug epidemic. This year, law enforcement in the Fort Myers region seized about 90 grams of fentanyl. That's enough to kill about 40,000 people. The recent drop in fatalities could be partially thanks to years of efforts to increase the availability of overdose reversing drugs like Narcan and addiction treatments. Last year, the Lee County School Board approved Narcan to be available in every school clinic. WGCU's Elizabeth Andarji spoke with a father who witnessed the tragedy of addiction in his own family and is now working with other Southwest Floridians to save lives.
She passed away in 2015 from an overdose of heroin and fentanyl. She was clean and sober for 2 years, and she was coming home the next day, and she got a hold of something the night before, and then there was fentanyl. And the next morning she was on life support for 6 days, and she passed after 6 days.
Drug addiction has touched countless families in Southwest Florida, including Al Kinkle, who lost his daughter. He's now helping others with a local recovery center named after her, Kimmy's Recovery Zone. Kinkle hopes his work will save lives.
Fentanyl right now, I would say, is the worst thing that I've ever seen in my lifetime when it comes to an epidemic, and basically that's what we have here. We have an epidemic. When Kimmy passed away, we had 50,000 people overdosed that year.
One tool in the fight to save lives is Narcan. The drug can reverse opioid overdoses within minutes, often making the difference between life and death. Local leaders learned how to administer Narcan during a demonstration. Brittany Ulino, a peer recovery specialist at Kimmy's Recovery Zone, is a former opioid user and has seen Narcan's effects firsthand.
I have used Narcan before on people, so I do know that it works, so I'm a firm believer in using Narcan. I love helping people. I'm a very active member in recovery, so I'm very passionate about it because my life is just so much better today being in recovery.
Kinkle says community collaboration is vital to addressing the fentanyl crisis. He's hopeful Southwest Florida will come together to confront the challenge.
We just wish that we would have had Narcan years ago, but we have it now, and we're using it to the fullest extent.
For WGCU News, I'm Elizabeth Andarji.
We are joined by Deb Camilla from Drug Free Lee. She's here to talk to us about addiction resources here in Southwest Florida. Deb, thanks so much for joining us.
You're very welcome.
So how much of an impact have we seen not just in our community, but nationally, getting Narcan out to so many public places. I mean, you really hear the word being spread about Narcan being available in so many places now.
It's just been great, and there's so many lives that have been saved, and this is just the tip of the iceberg. I think many, many more lives are going to be saved. Many, many people are going to be able to recover, and we know recovery is possible. So by giving people a second chance, we're able to help them recover and live fulfilling lives.
What do you want people to know about using Narcan? Who can do it? Is it hard?
I know.
Can we hurt somebody with it?
People are very nervous about using Narcan, but anybody can use it. It's a very simple nasal spray. They have directions on YouTube. And anybody can get it. You can get it from Kimmy's Recovery Zone, the Department of Health. There's a number of places where you can get it for nothing. And it's great to have on hand, and it's very easy to use. It's a one-pump nasal spray, and anybody can do it. Additionally, if you're not in the middle of an overdose and somebody gives you Narcan, it's not going to hurt you because it only addresses that part of the brain where the opiates are. So if you're not taking any opiates, there's no harm to you. So we don't need to be afraid of using Narcan, even if we suspect an overdose.
But no certification needed.
That's
simple
right.
nose
Just
spray.
caring people. That's what we need, is more caring people.
So I want to talk to you about what resources are available if somebody's listening and they know they have a problem, maybe they have a loved one who has a problem, as to what help is out there. They may think, I don't have the money to afford help. What do you want them to know about?
We are so fortunate in Lee County that we have United Way 211. So you can dial 211 from any telephone, and they're going to be able to hook you up with resources. They're going to be able to hook you up with resources if you have insurance, if you don't have insurance, support groups, sober homes. All of our resources are listed on United Way 211, and we really recommend that we use that and help people find help, because you start out by finding help.
I know Drug Freely is all about getting information out to people, tools out to people. We were talking earlier about you wanting parents to maybe rethink the way that they communicate with their kids about drugs, that talking about drug use is important and making them feel like they can talk about it without them getting into trouble, that's important. Can you talk about that?
Sure, and it starts when kids are young. Do you want the cookie or the banana? Why is the banana better? We talk about making good choices. And then they get older, and as we're talking to them, we find out what's going on at school. Is somebody being bullied? How do we handle that? Somebody offered them a pill at the playground. How do we handle that? And what we need to do is make sure that our kids are comfortable talking to us, because sometimes it's hard to listen. I mean, kids get a little lippy, and sometimes they don't want to talk. And if we continue in a casual dinner time conversation on the way to soccer practice, these are all ways that we can listen to our kids. And what's really important is that to tell our kids we love them, we care about them, and they're the most important things in our lives. And because of that, if you're in trouble, if you're in a bad situation, have a signal, text X to me. I'll come and pick you up immediately. It's not going to be a teachable moment. I just want you to be safe. I love you. And this is the message we want to give to our kids.
And that if they've made a bad choice, that they can talk about it, right?
That's right. And that's sometimes even more difficult. But I think we need to very, very much pay attention to how our kids are acting, who they're hanging out with, if there's a change of friends, if there's a change of behavior. All of these things can say that they need some help.
Deb, we so appreciate your time. Thank you so much for the work that you do.
Sure. Thank you for having me.
Coming up, is hurricane season changing? An expert from the National Hurricane Center shares what scientists learned from this past storm season. That's next on Southwest Florida in Focus. Hurricane season ends November 30th. This year, Florida's Gulf Coast saw 3 powerful storms, 2 back-to-back in Southwest Florida. Is this the new normal for storm seasons? Joining me now is Dr. Chris Lancy, the National Hurricane Center Chief of the Tropical Analysis and Forecast Branch. Dr. Lancy, thank you for coming over from Miami to join us. We appreciate it.
Well, I appreciate the opportunity to be here at Florida Gulf Coast University today. This is a great opportunity. It's my first time here.
Well, we know you're going to be speaking today to students and staff, so we're grateful for that. So, Dr. Lancy, it was a very difficult storm season for folks on our Gulf Coast. And a lot of folks are wondering, is this what we need to expect moving forward? Are we especially vulnerable being here on the Gulf as temperatures warm.
Yeah. There are some hurricane seasons where you see repeating patterns where one, part of a state gets hit and then very soon after the same part gets hit. We don't quite understand why that happens, but there's no expectation that's going to continue. We are in a busy period though. So since 1995, it's been most hurricane seasons have been very active. And Florida, of course, is a big target. So as long as we remain in this active period, there may be one or two or more hurricanes to hit Florida. So the key is being vigilant going forward and being ready to take action if needed.
So you've spoken about a view that some might be surprised by, that you don't think there's a significant link between climate change and current hurricane intensification.
Right, so the question about how is global warming, and that's man-made causes through extra greenhouse gases like carbon dioxide and methane, how that affects hurricanes is really important. We need to understand that. And what we think we understand now from theory and climate models is that hurricanes should be stronger, but by a very small amount. So by the end of this century, we're expecting hurricanes to be 3 to 5% stronger at the end of this century. So it's a very small amount, a long way off. Moreover, the number of storms and hurricanes is projected to go down. We may have 20 or 30% less storms and hurricanes.
Interesting.
Again, less, not more. The big concern I do have with global warming, though, is sea level rise. The sea level, Gulf of Mexico including, has been rising about 1 inch per decade. Sounds small, but that is likely to accelerate. And we could have 2 or 3 foot or even more of higher Gulf of Mexico levels in the future than we have now. So whenever a hurricane is going to make landfall, there's going to be more storm surge. That's that very dangerous saltwater flooding. So the question about global warming is very nuanced when it comes to hurricanes. But again, my concern is the sea level rise and the storm surge flooding.
A lot of folks and specifically I'm thinking of Charlotte County, had never seen so much water before. Specifically thinking about Englewood Beach, some parts of Punta Gorda. What do you want folks to maybe learn from this last storm season?
Yeah, every hurricane is different. And so you have to prepare differently because there could be threat from storm surge, could be threat from rainfall flooding, it could be from the wind. And so whatever the local emergency manager is suggesting, we need to listen to. And so it's our job as forecasters to provide the predictions and get the word out about the potential impacts. And then, because we want people to take the right action at the right time. Don't want to overreact and freak out a week in advance.
Sure.
But you don't want to wait until the storm surge is getting in your home before trying to get out.
And if we can end on the accuracy of forecasting. I know I heard you speaking earlier about how obviously forecasting has improved tremendously, but that perhaps we were getting almost to the limit. Could you talk about that as far as improving forecasting?
Right. In my lifetime, we've seen incredible advancements in how our track forecasts, where hurricanes are going to go, has improved. So as an example, back in the 1980s, when I was a student, an average 3-day forecast had an error of 300 miles. So if we said a hurricane was going to hit Fort Myers in 3 days, it really could have been anywhere from Havana, Cuba, up to Cedar Key. So a huge chunk of the coast. Today, the errors are so small, they're not zero, but now the error is less than 100 miles. So if we say a hurricane is coming toward Fort Myers, now we're looking at anywhere from about Everglades City to Tampa. So we've really narrowed down that cone. The cone has gotten smaller, which represents the uncertainty. We're never going to get to zero, though.
Yeah.
And there are some signs, suggestions, that we may be kind of plateauing how good we can get. And at some point, we really will have errors on track forecasting that we can't ever get rid of.
Dr. Lancey, we so appreciate your insight. Thank you so very much.
You're welcome. Glad
you.
to be here. Thank you.
Horseshoe crabs have been around for nearly 500 million years, even before the dinosaurs. Today, their blood is critical to many of us because it's unmatched in its ability to detect bacteria in medicines. Even after decades, the species is still being captured to harvest that blood, and now researchers are concerned about the population. Local citizen scientists are helping researchers figure out how the species is doing. WGCU's Tom Bayless reports.
They're spiny, armored, and related to spiders. While there are still a lot we don't know about horseshoe crabs, it's clear they are one of the most important animals in our oceans.
They were some of the first animals that, we have fossil record of on the planet. So they got it right the first time, so they haven't had a need to fix it or try to change it. So they're very cool.
Samantha Easterling is a volunteer coordinator for Florida's Horseshoe Crab Watch program in Southwest Florida. She spends her time observing, measuring, and tagging the creatures, and she shares her knowledge with others. Easterling leads classes like this one at the Naples Zoo. These citizen scientists will head to Southwest Florida beaches to look for crabs. When they find them, the volunteers will report the crab's location, sex, size, and if they have a tracking tag. This data will help researchers learn more about the overall health of Florida's horseshoe crab population.
The horseshoe crabs are definitely intertwined with those different populations. A lot of the shorebird people are actually here today to help with the horseshoe crab surveys because the horseshoe crab eggs are connected with the shorebirds coming over during their migration to eat those eggs and be ready to keep flying. And so everything's interconnected.
Claire Chard is a biological scientist with the Florida Fish and Wildlife Conservation Commission. She says the citizen scientists are helping throughout the state and encourages anyone to take part.
Just that we want the people that are living in this area or visiting to be involved with it. These animals are so critical to our environment and we're all interconnected. So it's great for having the ability to get out, do a survey. It's pretty low impact and you feel like a lot closer to the environment.
Naples resident Deborah Woods is a longtime citizen scientist focusing on shorebirds and eagles. She started counting crabs 4 years ago. Woods says as our climate changes, it's important to track what's happening to the ocean.
The citizen science of and providing the data for sustainability going into the future so that my grandkids will have the same opportunities that I do for loving nature.
FWC hosts these training sessions throughout the year. You can also find a virtual version on their website. If you find a horseshoe crab on the beach with a tag, you can report it at the Florida Horseshoe Crab Watch.
If you're already going on a nice beach walk, why not do a survey with us?
For WGCU News, I'm Tom Bayless.
As the season of giving begins, many of us feel inspired to support charities and causes close to our hearts. But with so many options, how can you ensure your donations make an impact? We offer you tips on giving safely and wisely to trusted charities. Joining us now is Charity Navigator CEO Michael Thatcher. Michael, thanks so much for joining us today. We appreciate it.
I'm really glad to be here. Thank you.
So a lot of us are in the giving spirit at this time of year. How does one know that the charity that we're thinking about donating to is reputable, is reliable, is responsible? Where do we start?
One of the easiest ways to start is, first of all, is it a charity? And know that they are actually a legally registered 501c3 charity, which is what the IRS code is. Simplest ways to do that is come to a site like Charity Navigator and put the organization's name in our search bar, and they'll come back and they'll be rated, they won't be rated. But if they don't come back and you don't find them, that may mean that they're not actually a legally registered charity. They might be something else.
So since you bring it up, a lot of us get invitations, on social media for a giving campaign. How do we even get a sense of whether the stories that we're hearing about, maybe somebody lost a loved one, how do we even get a sense of whether those are legit stories?
It can be more safer, I would say more reasonable, to go to a known charity for your giving, particularly when let's say we're wanting to do something with regard to a disaster that's just happened. There are going to be a lot of people that are affected, but there are also going to be a lot of very reputable organizations that are engaging in the disaster recovery process. And if you don't know the individual, I would go to a legitimate nonprofit in those cases.
So a lot of folks have a cause that's really important to their lives. And if we have a cause, let's say, in mind where we want to give, how do we, figure out which is the best charity to serve that cause?
It's a great question, and I think that's always the starting place in our giving, is that we're affected by a cause. It either makes us where it makes us happy, makes us sad, makes us angry. We want to do something. Take that energy and then actually find organizations that are doing that. So one, mission alignment. Does the mission of the organization and the work that they're doing align with your mission and your purpose around that cause? Using a platform like Charity Navigator can help you refine that further by actually saying, all right, these folks are doing it, now who's actually doing it well? And that's where ratings come in. And looking in the same way you would use a rating to find a restaurant, you can use ratings to find organizations to support.
Can you give us some red flags when we get a request to give to a particular charity? Any red flags out there that we should say, that may not be what it appears to be?
I think one of the red flags is when you're being rushed. Anybody who's really pressuring you and trying to get you to move fast, to pull out your credit card, slow them down. If they can't give you the name of the organization, and it's what we call an EIN number, which is the equivalent of a social security number, someone who works for an organization ought to be able to have access to that number. And that's one way of knowing it's a legitimate organization. The other area that people get scammed in is lookalikes. So the name is spelled a little bit differently, but it's not actually the nonprofit. It'll sound familiar, but it's not the right organization. Again, if you look them up, you can actually, even with the spelling they give you, if it comes out false, you're in a place you don't want to be.
There's so many great organizations doing great works in the charity nonprofit world. How critical is this time of year for them, and us digging a little bit deeper into our pockets to give at this time of year as far as their sort of overall budgets?
It's really, we call it the giving season, and that's basically the Tuesday after Thanksgiving, or Giving Tuesday, all the way through December 31st. It's when most nonprofits in the U.S. receive 30 to 50% of their annual revenue. The sector's really counting on you. The folks that are serving the people that you care about, or taking care of animals, the environment, whatever it is you care about, now's the time when nonprofits need your support. They need it all year round, but given that this is a time when we generally are giving, and we're also thinking about those that are less fortunate, now's a really good time to be generous.
Michael, we appreciate your time. Thank you so much.
Thanks for having me here.
Coming up on Southwest Florida in Focus, a look at an effort to add more art to some Southwest Florida parks. Big changes are coming to Fort Myers now that voters agreed to spend $75 million to create new parks and upgrade existing ones. One centerpiece of this renewal effort, art. At Lions Park, artists have already got a jump start on this initiative. Photojournalist Amanda Inscore-Whittemore captures the transformation.
We're the Fort Myers Mural Society, and this is our initiative to put art in the parks. Our theme is native species to this area of Southwest Florida, and these are animals that are actively alive and aggressive in the area. We have 26 total artists that are involved in the project, many of whom are local. There's a large group from Sarasota Chalk Artists Association. It includes international artists. We've got Thailand, Spain, Australia, I believe Italy. Student artists, we have retired area teacher artists, so it's a really good group. The city has an initiative called the Go Bond Initiative, and it's a program that will allow the city to expand its parks department. So part of the funding that's awarded a certain percentage of it has to go to arts. Lions Club of Lee County, they refurbished the lion here in the park. When you partner with the community and you ask them what they want, this is it. We feel blessed that we've been able to coordinate with neighborhoods and ask the people that live there what they want. This is what happens.
They totally redid the playground, so it is really nice and clean and fun for the kids. We did the mural walk and enjoyed all of the incredible pictures. We'll trade off playing pickleball and the kids are at the park playing, and so it's a really nice space now and we're enjoying it.
We like to be on the forefront of everything murals and public art, so if there's a mural around, we probably painted it.
Coming up next week on Southwest Florida in Focus, is it forgetfulness or something more? We talk to experts about when memory lapses could signal Alzheimer's and who should consider getting screened. And we also meet FGCU's new women's basketball coach. Be sure to join us for that story and much more on WGCU. Have a great week, everyone.